Dr. Sharvari Abhyankar. I am practicing Ayurveda. Okay. Can you see? No? Okay. मागे घ्यायला उचलून घ्यायला लागेल. That's it. थोडं. And today's my topic is blood pressure and its management by Ayurveda. So that's right. First we will see what exactly blood pressure is. By definition, it is blood pressure is the lateral pressure exerted by blood on the vessel walls while flowing through it. So now what is lateral pressure? It is the side pressure. See, this is the artery and blood is flowing through, and the pressure exerted by blood laterally on walls. This is called blood pressure exerted by blood on the artery walls. So this is the blood pressure. Proper definition of blood pressure is lateral pressure exerted by blood. Next. Now we will discuss some physiological variations. Physiological variations are the temporary variations. That is not exactly disease. You can say this is hypertension or hypotension, but with such in such conditions your blood pressure goes high or goes down. So first variation, age. You can see as age advances, blood pressure goes up. Then the gender, in males blood pressure is always slightly higher than females. Then next slide. This is build. In obese person, blood pressure is always higher than thinner person. Exercise. With the exercise also blood pressure goes high, but that doesn't mean that you should not do exercise. Okay. See, these are the variations. In exercise, the blood pressure slightly goes high. Then sleep. See, this child is sleeping so nicely. With the sleep, blood pressure goes down. It comes on normal or subnormal. थोड़ा सा low आ जाता है. Then with the emotion and stress, blood pressure goes high. If you are stressful, if you are in deep emotions, blood pressure tend to go high. Then we will discuss some types of blood pressure. Now generally we say that I have high BP or low BP. So what is actually high BP and low BP? Generally blood pressure has two types. That is hypertension, that means high BP, and hypotension, that is low BP. Low, just normal, just below normal is low BP, and higher than normal is high BP. Then it is the types of hypertension. Generally blood pressure problem is hypertension only. There are people, those are suffering from hypotension, that is low BP also, but hypertension is commonly occurred. So first we will discuss about hypertension, that is high BP. Again, this hypertension has two types. That is, first is called primary or essential or idiopathic. Idiopathic, that means your blood pressure for hypertension, there is no exact cause. No exact cause is known. And believe me, 95% of all cases there is essential or primary or idiopathic hypertension. Then the second type is secondary, obviously secondary, where the exact cause is there. So what are these causes? Maybe because of heart problem, because of renal problem, renal means kidney problem, or maybe because of vascular disease. Vascular diseases means diseases of arteries and veins. So secondary blood pressure is where we know the exact cause. That person is suffering from kidney disease, that's why he is having hypertension. He is suffering from some heart disease, that's why he is having hypertension. So generally we get this primary or essential or idiopathic hypertension, that is high BP. When person says that I have high BP, so most of the time he is having that essential or primary hypertension. Next slide. Now these are the classification. When doctor... Okay, first I would like to tell you what is systolic and diastolic blood pressure. Systolic is maximum blood pressure and diastolic is minimum blood pressure. Systole means contraction and diastole means relaxation. Then you all must be knowing that our heart is a very good pump, and when it pumps, when it contracts, the pressure at that time is systolic blood pressure, and when it relaxes, the pressure at that time is diastolic blood pressure. So when doctor says that your blood pressure is 120/80, so 120 is systolic blood pressure and 80 is your diastolic blood pressure. So now when we say that I have severe blood pressure, I have severe hypertension, so these are the some classification. So when normal systolic BP less than 130 and less than 85 diastolic, then high to normal, subnormal is 130 to 139 systolic, 85 to 89 diastolic. Then grade 1 mild BP, it is 150 to 159 systolic, 90 to 99 diastolic. Grade 2, that is moderate, medial, is 160 to 179 systolic and 100 to 109 diastolic. And severe hypertension, that is grade 3. It is more than or equal to 180 systolic blood pressure and more than or equal to 110 is diastolic blood pressure. Then again there is one condition where isolated systolic blood pressure is high. More than 140 systolic is and less than 90. See here diastolic is not going high, only systolic is going high. That is called isolated systolic blood pressure. Next slide. Now we will discuss some risk factors of hypertension. When person are at risk to have hypertension. So first is, we can see this obese person, see he is watching his weight. So as weight increases, as person becomes obese, his blood pressure is going high. Because our heart has to pump. If the person weight increases, his volume increases, so heart has to pump more forcefully, and because of that blood pressure goes high. Then the diet, if person is taking high sodium diet, we can see here wafers or Lay's, Cheetos and something like that. High salt diet, then his blood pressure, such person are more at risk to have hypertension, that is high BP. Next. Then smoking is the very, very important cause for hypertension. If the person is smoker, then in long run he is going to have hypertension. Then alcohol abuse, alcohol is also the main cause for hypertension. Next. Individual with high normal BP, as we seen in previous slide, that high normal BP, that is 130 to 139, if person is having his BP between 130 to 139, that is high normal BP, then he is more at risk to have hypertension, proper high BP in future. Then stress, if person's life is stressful with all emotions, then he is going to have hypertension. And obviously age, as person grows, his BP goes high. These are the risk factors. If person is already aged, then he is having more risk of having hypertension. Next. Now again, I previously also discussed, if he is male, the person is male, then he is at risk. Then family history, you all must be knowing, if persons have mother or father is suffering from blood pressure, then he is more at risk. Then hyperinsulinemia with or without diabetes. Now this is the condition where extra insulin in blood. So such persons are also at risk to have hypertension. And sedentary lifestyle. All we have that lifestyle only. We don't exercise, we just eat and we sit in our office or in our clinic. So it is sedentary lifestyle. We have lift and elevators, we don't use staircases, we don't walk, we have taxis, bus, etc., etc. That's it. So we all are at risk of hypertension. Now we will discuss some target organ damage. Now what can this hypertension do what can this hypertension damage in our body? So these are important organs which can be damaged because of this hypertension. So first is brain, you can see. There are cerebrovascular diseases because of this hypertension. Cerebro is term for brain. Cerebrovascular diseases like stroke or hemorrhage can be happen because of this hypertension. Then renal disease, that is kidney disease. Again, kidney and hypertension are very, very, very well related with each other. Like if person is having hypertension, uncontrolled hypertension, he is going to have renal disease. And if he is having renal disease, he is going to have hypertension. Because of these renal diseases, the blood cannot be purified very well. So the blood viscosity, that blood becomes thick. Blood में जो विषारी द्रव्य है वो रहते ही है, वो पास होते ही नहीं है because of this renal disease. And with such condition, hypertension goes high. Viscosity means thickness of blood. We all must be knowing that if the fluid is thick, then pressure exerted by that fluid is more. So as blood becomes thicker and thicker, the blood pressure goes high. So renal disease and hypertension is very well connected, very well. It is like vicious circle. This is because of this is because of this. Next slide. Heart disease, again the main organ which can be damaged by this hypertension. That heart disease क्या attack आ सकता है, myocardial attack because of this hypertension, which we all must be knowing. If person is having heart disease, doctor first says that control your BP, or if he is having hypertension, he is going to have this heart disease also. Then retinopathy are the diseases of eyes. If blood pressure is high, retinopathy like the eye disease like glaucoma or hemorrhage inside the eye can be occurred. Some vascular disease. Again, vascular disease means the diseases of veins and arteries. We all know artery is the blood carrying, oxygenated blood carrying device, and vein is deoxygenated blood carrying device. This is called aneurysm. Some bulging of artery is called aneurysm. This is the artery, normal, and here it is the bulge. This bulge can be ruptured. This bulge can be ruptured, causes hemorrhage. So this vascular disease can be anywhere. It may be occurred in brain, maybe occurred in heart, maybe occurred in renal or in eyes also. So these are the vascular disease. So arteries and veins can be targeted by hypertension. And finally is atherosclerosis. Atherosclerosis is again the disease of arteries where the thickness of walls get increased. This is the normal artery and this is the thickened artery. Because of hypertension, walls of arteries gets thickened. This is again the same, which is very related to hypertension. If person has having hypertension, he is going to have atherosclerosis. This is atherosclerosis, thickening of blood wall. And if he has having this atherosclerosis, he is going to have hypertension. Because of the wall thickness, blood has to exert more pressure on these walls. So blood pressure goes high. And because hypertension is there, as blood pressure is more in blood, so it exerts more pressure on walls. So these heart becomes, walls become thick. So it is again very much related to this hypertension. Next. Now we will fastly discuss regarding hypotension. Something about hypotension. Hypotension is not exactly very much troublesome disease. Actually, it is not a disease. It is just a physiological state than a disease. When the systolic blood pressure is less than 90 and the diastolic blood pressure is less than 60, then we can say that person is having hypotension, that is low BP. Next. There are some signs from which you can say that the person is having hypotension. Obviously, with the measuring of blood pressure is the main criteria, but these are some symptoms like chest pain, shortness of breath, irregular heartbeat, headache, lightheadedness, stiff neck, seizures, that is convulsions, that is fits, and loss of consciousness in advanced stage, profound fatigue, and temporary blurring or loss of vision. This chest pain, that is because of heart pain. If blood is not getting sufficient blood supply because of this hypotension, then chest pain can be occurred. And these symptoms, loss of consciousness and convulsions, are like in advanced stage. If hypotension cannot be cured or it is not cured, then this condition happens. Next. Now there are causes of hypotension like low blood volume. If a person is losing blood in accident or something like that, then he is going to have hypotension. Then severe diarrhea. Then because of the diarrhea, dehydration occurs and hypotension occurs. Then widening of blood vessels, अगर blood pressure wide हो गए, blood vessels wide हो गए, then hypotension can occur. Then there are some medicine side effects. Generally medicines are used in hypertension, can cause hypotension in some patients. If a dose is not adjusted or something like that, then this hypertensive medicine can cause hypotension. Anemia, as we all know, अगर blood कम है तो hypertension होगा ही. And again heart and endocrine problem. Heart, in some cases, if heart is not powerful enough to supply or pump powerfully, then hypotension occurs. And again endocrine problems like hypothyroidism, hypotension is there. Now we will discuss this hypertension or blood pressure by Ayurveda point of view. Now Ayurveda doesn't mention anywhere that this is